Good morning. My name is Dr. Hamza Baumia, and I'll be taking you through artificial intelligence for health workers. What is artificial intelligence? So, artificial intelligence is just computer science that focuses on creating systems that perform tasks that typically require human intelligence. So, tasks like learning, reasoning, problem solving, understanding language, and decision making. These are tasks that are known to be done by humans and it requires human intelligence. For instance, you will not see a dog reading or learning because they don't have that kind of human intelligence. Um, Certain animals will not be able to understand language and make decisions, high level decisions. So these things are the kind of things they are training computers to do so that they're able to do tasks that require human intelligence. So we can group AI into two basic categories. We have the traditional AI, that's the discriminative AI. For instance, you try to teach the computer to be able to discriminate between one set of things from another set of things. So, for instance, we load over 100,000 X-rays into a computer, and we train the computer to be able to identify X-rays that are for pneumonia and X-rays that are for maybe fractures, X-rays for tuberculosis and the rest. So these computers are trained. They take their time to scan the images and look at them carefully. And then we show it certain patterns that make us diagnose certain diseases. And with time, the computer learns all these patterns. Then we test the computer with new pictures or new X-rays that have certain diagnosis, but we don't tell the computer the diagnosis. So the computer is supposed to use what it has learned already to try and tell us the diagnosis. And over time, they train the computer to get accurate diagnosis. So sometimes it makes mistakes, and then they train it again with the ones it made mistakes on so that it can perfect its learning. So basically that's it. And computers, as part of discriminative AI, there's also voice recognition. And if you look at voice recognition, this is how a computer picks up your voice. So when you speak, the high pitches and the low pitches and everything in your voice is picked up by the computer, and it characterizes it with this kind of pattern. So the way you say a word has a pattern that's different from what another person's pattern would be. So the picture, and the computer is able to use these patterns to identify your voice, and also the way the word is can be gotten from this pattern. So it knows which word you are mentioning and who is saying it. So you can have voice recognition being used to maybe lock your phone, and then the day you have a sore throat, you find out that your voice is not able to give the pitch that the computer recognizes, so you can't open your phone, something like that. Okay, so there's the second group or second category of AI that we call generative AI. Here, in this case, the computer uses the knowledge it knows already to generate something new, like data augmentation, content creation, etc. So, for instance, as I said earlier, you could have given the computer 100,000 X-rays of maybe pneumonia. It looked at all the patterns, and then you ask it to generate a new X-ray. So it will generate or create a new X-ray that's different from all the 100,000 ones you've given it, but also has the same diagnosis of pneumonia. In that case, it picked up the patterns from all the X-rays you've given, and then it's superimposed them on each other in such a way that it generated a new image that's different from all the images you've given it. But when you see it, you know that this is a pneumonia X-ray or something like that. The same way, based on what AI has learned with languages and text and stories and everything, You can just ask AI to write a story, and it will generate a story for you based on what it knows already, and it will generate a new story that's different from all the other stories that you know. Mhm. Okay, so how does AI work? Um, it works by learning patterns and also is able to learn context. So, for instance, we have a pattern here, OAO, then OBO, then OCO. If you look at it carefully, we are just putting the alphabet in between the O's. So we start with A, then we come with the next one, continues with OBO, and then CO. So now looking at the pattern, we all know that the next pattern or the next pattern will be what? ODO, then ODO, all the way up to OZO. So you can give this pattern, leave it, and then the computer will complete the whole thing for you. So it learns a pattern and then it will generate the rest. That's the generative AI. The beauty about AI is that it's able to understand context. So in this case, if I say I will, example, I will, and then I ask any of you, can you complete this sentence? I will, then you'll be like, oh, I will dance, or I will go home, whatever you want. But if in case we are talking about food, if we were talking about food, then you would normally complete the sentence with I will eat or I will cook, which makes sense because we are talking about food. That is the context. If the context changes, for instance, if the context is exercise, we are talking about exercising, then you can talk about I will run, I will jump, I will skip. You get me? So that's the context. In that context, when we are talking about exercise, you will not go and say I will study. It's out of context. And then the last one is if we are talking about entertainment, things that you can say with the same I will as in the starting of the sentence. You can say I will dance, I will sing, whatever you want to say that's related to entertainment. So AI also knows the topic. Once it knows the topic or the context you are talking about, it will also talk to you in that area. So if you are talking about health and medicine, it will give responses in that area. If you are talking about sports, it will give responses in that area. That's the beauty of it. Let's look at some brief history of AI. So AI has been around for a while, actually a long time. The concept of artificial intelligence started in the 1950s, long ago. Just that the problem was that the computers they had in those days were not powerful enough. You couldn't load about 100,000 X-rays into a computer at that time. So people were doing their research, PhD research, and the rest in these areas, but most of it seemed theoretical. And then in the 1980s, 1990s, there was the internet started, and we had more powerful computers coming. All of you remember floppy disks. When we had floppy disks could only take 4 megabytes. Right now, a picture, just a simple picture from a good camera could be even more than 4 megabytes. So that's it. And then in the year 2000, we saw a breakthrough with deep learning and big data. That was when the internet was advanced a little more, and we had good computers like good storage. We had external drives, big drives that could take terabytes and terabytes of data. So once these big external drives came along, companies like Google and the rest realized that look, they could go into this artificial intelligence thing because now the hardware and the tools they needed were available. So then they started training models. They built models. The model was built just like the human brain. So you're able to feed something into the computer. The computer is able to learn it, and then you come back and ask the computer or test the computer to be sure that it's been able to learn it. If it gets some wrong, you go back and retrain it. So that's what they did. So in 2007, sorry about that. In 2007, this led to advanced models such as the GPT. So when you hear about GPT, ChatGPT, and the rest, the GPT means generative pre-trained transformer. So the whole transformer model has been trained already. And if you know about ChatGPT, ChatGPT 3.5 was released to the public by OpenAI only in November 2022. So just when we're entering 2020, ChatGPT was released. That marked a major milestone in a conversational AI. So AI could now chat with you. We'll look at it in the practical session and you see. And it became a widespread thing. So AI, today we are in 2025 now. So AI is just about 3 years old. Not exactly even 3 years yet, because it was November 2022. So November 2023, November 2024. They are not even November 2025. This is just February. So it's not exactly 3 years yet, but it's making a lot of buzz in and around social media and everywhere else. Okay, so why do we say AI is the next big thing? The next big thing because it's using computers. Computers can process a vast amount of information and they can learn faster than humans. So, for instance, like us as doctors, we spend up to 6 to 7 years in medical school. Then you come out and you're a doctor. Now, all the textbooks, all the information you learn in medical school can be loaded into a computer within days, and it will know everything. In fact, they tested some of these models with the USMLE, the American Exam for Licensing Doctors, and they found out that the models were able to perform equal to or even better than doctors. So that's it. Of course, when we talk about AI replacing doctors or nurses, it's not really gonna happen. It would cause a lot of job disruptions, but it's not going to happen entirely because, of course, AI cannot examine the patient, AI cannot do the injections, AI cannot really take care of the patient in terms of the physical stuff. So that's it. So by obviously you need the doctors, you need the nurses too. But as another doctor would say, if you're a doctor that AI can replace, then you should really be replaced because it means that you don't have that empathy, you don't have that physical touch, that extra to what AI can do. Okay, so the next one is that computers never get tired. AI will not get tired. It keeps learning. So computers can be reading 24/7. Whilst you are sleeping, the computer can still be going through and skimming through documents and scanning and learning from these things. So you can't learn faster than the computer. And your brain, in terms of the amount of data that your brain can store, is limited. Computers, if the hard disk is getting full, they can just add another hard disk. So it tells a lot. And then computers don't take salaries. So quite a lot of industries are trying to move computers and work with AI to avoid paying salaries. So by means, some people will lose their jobs, but if you can take advantage of AI, it will make your job better. Okay, so in which areas is AI very good at? Okay, so let's bring it to the medical field now. So AI is very good at dealing with text, written or printed words. It's able to analyze and summarize text. It's also able to deal with images, very good at images, image recognition and the rest. And then we've also mentioned that it's good at voice recognition already. In medical practice, we know that about 62% of our time as health workers is spent in dealing with paperwork, that is text, written or printed information, printed words. And so if AI is very good at text and text most of the time, then we should be able to use AI or leverage AI to make our work easier. So that instead of spending 62% of our time dealing with text, we would be able to find more time for our patients to have direct interpersonal relations or direct contact with our patients rather than spending all the time typing. So we do reading and writing most, the documentation stuff, which AI can do now. And then AI is also very good at images. And we also deal with images a lot in our field. Chest X-rays, CT scans, MRIs, all those things. So these are some of the things. And then, so how can we use AI to make our work easier? There are several tools that can be used to make our work easier. For instance, there's the AI scribes. Example is ambient listening and also deep scribe. These are two examples of AI tools that can be used. What do they do? The ambient listening it has voice recognition and it can do voice to text. So as you speak, it can type for you. So some doctors actually, it's not something new. People are using it already in some countries, America and the rest, where when the doctor is speaking with the patient, the deep scribe or the ambient listening tool is listening to their voice and recording all they are saying. And if these tools are specifically developed for medical field, so it's tuned to the point where that it knows how to write the medical history. So it knows what is presenting complaints, it knows what is past medical history, it knows what your treatment and your diagnosis are. So when you are speaking with a patient and you are talking, it's pulling out that information, putting them at the right place under which category it should be. So this makes our work easier and it saves you a lot of typing. Apparently in America, for instance, they say if you are using the AI scribes, it saves the doctor about 3 hours every day of typing. Okay, then let me just go to the practical session. So we've seen the deep scribe and the ambient listening. Unfortunately, in Africa, well, in Ghana here, we may not be able to use the deep scribe and ambient listening tools as much. Why? Because we speak other languages apart from English, which AI has not been trained on, unless we decide to do the training ourselves in our country. For instance, when you want to ask a patient if the patient has headache, in Twi you would say utiya oya or utipayo or something. The AI doesn't understand utiya oya, so in that case, it can't type and that whatever complaints or whichever category you want it to do. So in that case, it may not be that practical here unless you are speaking English completely. Okay, let me just go to the practical session. The other tool is analysis and reporting tool. So I'll look at it here. So let's look at the first practical thing we are going to do. Okay, so I've mentioned ChatGPT. We are going to go to ChatGPT right now. It's just a website. So we say chatgpt.com. So when you go to chatgpt.com, well, to ask you to sign up and whatever, let's go on and see. Or you can just ask a question. I'm going to ask it a question like, who is the current president of Ghana? So once you ask it, who is the current president of Ghana, it started as of February 2021, February 21st, 2025. The president of Ghana is John Dramani Mahama, blah, 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 who was born in blah, blah, blah. And then it gives you the reference where it got that information from the Reuters.com. It's giving you the reference here. This is just a summary. So if you were to ask the same question in Google, let me just copy the same thing and just put it in Google. Google will show you pictures and stuff and 100 different websites where you can go and read. But now you have to read. If you are mistaken, you go and click on Nana Addo Dankwa, then you go in before you find out that, oh, the current president as of 2025 is no longer Nana Addo Dankwa. So Google will just give you this because at this point it's not using the artificial intelligence. They've added it to Google search anyway, but sometimes it doesn't respond as you want to. Okay, but instead of going to 10 or 20 different websites to read, you've just gotten the summary right from ChatGPT here. And that's the thing. So that's what makes it easier and faster. Let me look at the other one. So now let's look at something medical. I'm going to ask it a question. The question says, the patient has fever, chills, and vomiting. What's the most likely diagnosis? So I'm just going to ask it here. So I'm pasting the question in the text box here, and then So it says fever, chills, and vomiting can be symptoms of various conditions, most likely. Then it starts gastroenteritis, malaria, influenza, sepsis, meningitis. So it's just spewing out the information for you. And it talks about it's crucial for the patient to see a healthcare professional, blah, 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 blah. Okay, so I've given it this. First of all, it's trying to give me a response, assuming that I'm just a layperson. If I go deeper, like I give it context, I am a doctor. Okay, I'm a medical doctor. And I say, give me more information. It knows that we are still talking about the question I asked. It says, thank you for clarifying, giving me that. Given that you are a doctor, it's going to give me more information, the clinical presentation, the diagnosis, the management. You get me? So if you don't tell it your field or what exactly you want, it will give you basic information, some information that may not, you may think it doesn't know, but it knows, just that it doesn't know that you are a professional in the field. So it should give you more detailed information, like professional level information. Mhm. So these are, because if it was just an ordinary person, it wouldn't talk about these antiviral medications with examples and all that. Okay, so now let's go and see causes being sepsis, influenza, malaria, and the rest. Now, if I told you that my patient lives in America, it will continue with the conversation. It knows conversation, it understands that we are talking about something. So if the patient lives in America, now it's talking about influenza, gastroenteritis, and a few others, but malaria is not the top one again. And then it's talking about the, because I told you I'm a doctor too, it's giving me some of the tests that we have to do and all that. Okay. Then I say, okay, so my patient lives in Ghana. This time around, we are coming back home to Ghana. So, okay, so it's not finished with what it's saying. Because I said I'm a doctor, you see the way it's giving more information. And it categorizes the information with bullets and stuff. That's the nice thing about it. So it makes it easy for you to zoom into where you want exactly. Okay, it's still writing about this. I can stop it. It's okay. I don't want any more information, but I'm going to ask it another question. So this patient lives in Ghana. Then its first diagnosis, because we live in Ghana, will be malaria. Then it's talking about the clinical presentation, the blood film being the blood smear being the gold standard. Rapid diagnostic tests can also be used. You get me? So there's a lot of stuff that you can learn just by, or you can learn just by chatting with AI. Okay, so I'm going to ask you the next question. The test was positive. Remember, all this, because it understands context, it can discuss with you. If you go and paste the test is positive in Google, Google will not even know what you are talking about. It will just start. So Google also has some AI anyway, thinking that I'm talking from Ghana. It knows that I'm talking from Ghana. So I will just give you some websites where you can see information. It's not actually in context compared to it may even go other. Where did I put it? Okay, so let's come back. Okay, it's spoken about all this already. Now I'm putting it in the malaria test was positive. So you see how it gives. So now it's starting to answer this question based on what we've been discussing so far. So you can continue a conversation from where you left off. Given that the malaria test is positive, this confirms that the patient is infected with Plasmodium species, likely falciparum, which is a common and dangerous species in sub-Saharan Africa. So that's the likely one. Then it's talking about the fact that you should assess the severity, complicated malaria, whatever you should do, look at hypoglycemia, shock, acidosis. So even if you've forgotten something, you can still look at it here. Then it's talking about the treatments that are given here. It's talking about Coartem, artesunate, blah, 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 treatment given orally over 3 days as first line treatment for uncomplicated malaria, severe malaria, and then the monitoring, look at parasite clearance and everything else. It's even gone all the way to talk about pregnancy and everything. Now I want to so I'm saying that, but my patient is 3 years old. Because talking about pregnancy and everything, I just wanted to zoom in on a particular area. So once I say my patient is 3 years old, then for a 3-year-old, blah blah blah, assess severity. Then it's giving the clinical guidelines for 3 years old with the dosages and everything. So even when you've forgotten your dosage, you can just ask ChatGPT. Of course, as I earlier said, it depends on who trained it and what information they've used to train it. Okay. So these things are there. We've seen it here anyway. So this is the first example I've given you. Let me look at the other examples. So there's also another. Okay, so we look at Unriddle AI. So there's also another website you can go to, which is Unriddle, UNRIDDLE.ai. So if you go to Unriddle AI, it will open. Unriddle AI, you can just upload a document. It says record import. So you import a document and you can start asking questions from the document, ask it to summarize the document and everything. I've done that. I've uploaded one document already because of time. So I have a document here, which is the guidelines, 2024 guidelines for primary prevention of stroke. If you don't, the document is 88 pages. If you don't want to read the whole document, you just upload the document to Unriddle AI. So this is also AI, but it's been trained in a different way to take uploaded documents and then summarize it or read the whole document and answer questions from that document. So this is the research paper as the guidelines that have been put here. It's an academic paper. You can see AI has just summarized it, telling me that from this paper, key recommendations include regular screening for stroke risk factors, and then management of hypertension with greater than or equal to 2 antihypertensive medications. That's a recommendation. And adherence to the Mediterranean diet for adults at high risk. So if, for instance, I don't understand what Mediterranean diet is, I can just scroll down here and ask. I've asked this some questions already anyway, but it will even suggest to you, these are suggested questions from the paper, what implications do sex-specific recommendations have for stroke prevention? So the document is a long document, this is 88 pages, so I have to scroll down here. Once you scroll down to the end, there's the Unriddle AI chat boxes here. So you can start typing your questions here. I think I've over-zoomed my page, so I'm not able to see the chat box properly, but you can enter your chat here and ask questions. Why am I having this? I zoomed the page out so that, and the paper is quite long. So now I can ask questions here, type questions here, and ask just like we do with ChatGPT. Just because my paper is too long, it's 88 pages. So you can ask questions. For instance, I asked the question, what are the key recommendations in this article? When you ask the question still remains with the answer. It will pick from the paper. Then look at this one. What gaps in research are highlighted regarding the management of stroke risk factors? So then it will look at the paper again and read and find out areas. It says several key research gaps are highlighted regarding stroke risk factors. Then it gives you one clinical trials and population data, blah, 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 blah. So this is another example. If you have a big, you don't need it just for academic. If you are going to sign an insurance document and you don't want to read the whole thing, you can just upload it to Unreadable AI. It will summarize the whole insurance document for you. Some of these insurance companies are hiding some of their policy things in small print and they don't want you to see. So you ask AI, what specifically, you ask them, what are the key things I should look for in the small print? And it will look at the small print and list them for you so that you know what you are signing for. So all these things are there in Unreadable AI. So that's another one. We've looked at Unreadable AI. We've looked at ChatGPT and asking questions or conversing with ChatGPT. Then the next one is data analysis. Okay, so AI can be used for data analysis. Last time we did a screening for one company and we looked at their BMI, we looked at their blood pressures, we looked at their blood sugars, and then we came up with certain diagnoses based on the results we got. Now, I'm not going to tell you which company it is anyway, but that's why I deleted their name at the top before I'm giving this. Okay, so here we did the BMI, body mass index. Below, we have these ranges here, BMI values here. And then we said, I think this should go, yeah. Okay, so we said severely underweight, 0, underweight 2, normal people were 36, overweight people were 31. So what I did was I just decided to copy this. The company wanted a report and I had this data. I didn't want to go do Excel or anything. So I just used the information I have here. So here I have it. I'm just going to show you what I did with ChatGPT. So I'm going to paste the whole information here. So that's the information for the BMI. The total number of patients who were in each category were here. And then I just stated it that I have the above data from a health screening program. Well, based on the data, can you give a summary in percentages? I wanted it in percentages. Sometimes when you tell people 31 of you was this, 2 people were this, it doesn't make sense to them. When they know, 50% of your workers are overweight, then they understand that, well, we think we have to work on this weight issue, or 50% of your workers are hypersensitive. So it means that most of them will be taking excuse duty to go to hospital for their medicine and blah, 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 blah. What about the diabetics and all that? So I've asked it to generate in percentages. And also I wanted to draw a graph, bar chart or something. So I asked AI to generate a downloadable .csv, is just an Excel file from the categories and the percentages. So that's what I've asked it to do. Then I submit. Now let's watch what it will say. So it will think a little and start. Because I haven't logged in, it's telling me it's unable to do this for me. Okay, let me see. I should be able to do this here. I don't understand why it's not. Okay, let me take out the CSV and see if it will be able to pick up information. Because I've tried it yesterday, it worked. I don't know whether it's my internet or what. Or maybe now that I'm asking for the CSV. Okay, so let's see what it will do with this. So it's just give me the data and give me a summary of percentages. That's all. Okay, so now look at it. It's taking the data I've given it. It's found the total number of patients to be 88 individuals. Then it's calculating the percentages for me. So then it gives me the summary. So the summary says severely overweight. There's nobody who is severely overweight. Is severely underweight. There's nobody. 0%. Underweight is 2 point this. Normal is this. So now with this information, I can go and just draw my graph. Actually, I did it. The ChatGPT does not draw images, but there's another one. If you go to Bing, that's the Microsoft Edge. Microsoft also has its own AI, which they call Copilot. So when you go to Bing, there's Copilot. That's copilot.microsoft.com. Once you go there, you can also, let me just copy from ChatGPT what we just did, these percentages that it doesn't want to draw for me. Okay, so I have these percentages. Let me ask Bing AI to see. If I know Bing AI can draw. So can you draw a bar chart? Let me see if it will do that. Bar chart with the data. And then let's see if it can get me a bar chart. So now Bing AI has drawn a bar chart. So when you have data in your hospital, you can easily upload this into AI, any of the AI platforms, and get a summary of the report. Some can generate graphs, others cannot, and there are many others. So we've looked at ChatGPT, we've looked at Bing, the Bing one from copilot.microsoft.com, and then we've also looked at Unreadable AI. Okay, so as I mentioned, Unreadable AI can help you with your research article. If you have other documents, you can also look at them with Unreadable AI, upload them, and then get answer questions from the even write scientific articles and research papers, also consensus. So these are 3 different websites you can go to and then write your research papers. You can write, I think Jenny AI can even write your literature review for you and give you references and everything based on the topic you give it, and to check all that and write. So they've loaded a lot of research papers into that model and it's able to do that. So though AI is big, there are different companies doing smaller or focusing on different areas to do the work. So you do that. And some of them you have to pay for. Even with the one I just showed you, the Unreadable AI, you create an account, you can do some for free, upload up to 5 documents a day and stuff like that. But if you want to have unlimited access to certain other features, you have to pay. Some of them are like $9 a month and etc. And these companies have spent money and time to build, so they also want to get their money back. So we've looked at the practical session already, so I'll skip this. And then you must also remember that AI can make mistakes. So as we said, ChatGPT was released just in 2022, which is less than 3 years ago. It was in November, and we are still in November 2022, and we are in February 2025. So it's still less than 3 years now. And it's a pre-trained model. So it was trained with information before this time, before it was released. So if there's any new medical information, they said they trained it up until 2021. If there's any new information, 2023, 2024, it will not have it on hand unless it starts reading from the internet. It actually goes online to check something, but most of the time it will answer you based on what it knows already, just to make the system faster. And it can also generate some false information once a while. Some information is too basic. Some information is not true because of the way it generates information. Sometimes based on what it knows, it tries to just guess and say something, and it writes so confidently sometimes that you may think it's right. There's a story of a lawyer who used ChatGPT to prepare his cases, and then some of the cases he referenced were actually made up cases that were made up by the ChatGPT. So this is what they call hallucinations in the AI world. The output also depends on the people who trained it, as we know already. So if somebody is sitting in Nima or Kaswa and training a model, and he's not a medic, but just copying stuff from the internet and training a model, the model will only use that chaff that was put in it. So it's important that you, the expert in your field, will use AI with your own discretion, knowing that it can make mistakes, and the fact that when you are using a particular AI website or a model, you must also know who trained it. You should check the background of it first to be sure. There are potential workforce disruptions. AI may change certain jobs, but for us doctors and nurses, some people may lose their jobs, but if you are on top of your game, it's not likely that you lose your job. You will use AI as a tool rather, just like when they came up with robotic surgery. Everybody was like, robots will take over robots, but in the end, the surgeons are the ones using the robots to do the surgery. So surgeons sit behind the machine and use it. Similarly, that's what's going to happen. We will use AI as a tool. In actual fact, some people even say that AI is like a co-pilot. So you are the pilot, and AI will be your co-pilot to help you like an assistant. In the near future, AI will be integrated in most of these electronic medical records that we are using already. So with time, you find out that AI will be part of it. So once you are writing medications and things, AI is checking the past medical history of the patient, and they just prompt you that, oh, this patient is known to have asthma. Some years ago, another doctor diagnosed him or her of asthma, and maybe you might not have read that in the notes, so you get that information. Or when a patient is already on some medications and there are drug-drug interactions, AI may help you to pick it up, or it may even prompt you. Predictive analytics for disease outbreaks. AI, with time, when it's integrated with our electronic medical record system, to be going through our records, learning from the data, and it can be able to predict based on maybe patient's attendance. That if based on this month's attendance and the complaint, it's likely that there's a cholera outbreak or something in maybe Taifa or Bamikwabenya or somewhere else. So these are some of the things you'll be seeing here. Yeah. So let's round up. There are issues with AI, some of the issues and pitfalls with AI. I've mentioned the fact that it can make mistakes already. There are also issues of privacy and security. These machines are learning lots of data from patients' information, and if we are not careful to anonymize the data we are feeding into this information, when there's a breach, people can get a lot of patients' data. So normally they anonymize it, they remove the patient's names and patient's IDs and everything from the data before they allow the models to learn from it. Also, there are biases in algorithms, which is normal because people training these models are mostly from America and Europe and others, and they are using their data. So sometimes their data may be biased towards them compared to African populations. There's also a lack of infrastructure. AI requires internet access. It's not like a software that you buy and then come and install on your computer. Most of it is being run as a service. So what they call software as a service. So you have to create an account and use it, and then you pay for it for most of them. So in parts of Africa where there's no internet and the limitation there, then over-reliance of technology. It's important that health workers keep themselves updated with their skills and their knowledge base and their knowledge, because you can't rely on AI to be learning for you or AI to make decisions for you. You have to be an expert in your field, then you use AI as a co-pilot. And there's also training and capacity building, which is an issue. Well, luckily for us today, we are having some small, this is an introductory AI training course. This is an introductory AI training presentation that we are having here so that health workers can know how to use AI, should also know the pitfalls in AI, and then we'll be able to navigate the artificial intelligence things that we are hearing about and use it effectively for our work. There's also the cost. As I said, the Americans developed ChatGPT. ChatGPT is free, but other AI websites and AI applications that you can download on your phone and stuff, not all of them are free. And the Americans developed it at several billions of dollars. They spent several billions of dollars to develop it, and so they have to make their money back. Luckily for us in Africa and some other places, the Chinese have also developed their version of it. Just this 2025, they've also released DeepSeek, just like ChatGPT. It was tested and found to be equally as good as ChatGPT, and it's free. So as the price goes down, we will also start enjoying more and more of it. Thank you.